Today we've launched an advanced collaboration for early childhood development that's looking at identification of certain types of conditions at an early age. We're taking, examples of cases that we are exploring related to, for example, congenital hip dysplasias. These are conditions that are related to the hips of children. So babies, when they are born, they may have problems with the hip joint, and it can give them difficulties as they grow over time. And these are things that if you catch them early, you can do something about it so that they don't become part of a disabled population as they grow. The other is, we were talking about autism spectrum of disorders, which is also a growing important issue that needs to be addressed. UNICEF is really interested in pushing for every child to have equal access to healthcare and services across board. And disabled children who miss out on these services are very important. They're the ones who sort of get lost between the cracks. So what we started today is looking at how best to position services across the 5 states in southern India to think about screening methodologies, creating centers of excellence so we can have a good body of evidence that's growing, and we can support government services in providing screening and post-screening services for these children so that we can give them the best opportunities as they grow through their life. So, and today's activities, the launch, the discussions, has brought together multiple stakeholders from across the board. That includes academicians. We have people from the private sector, people from government, from many states across board who've come together because this is such an important topic, and it is the story we tell about not just about the survival of children, but also give them the opportunity to thrive, to grow, and from an equity focus where we are looking at every single child across. Not just in the cities, in the rural areas, in different components that are missing, and being able to provide the sort of services that are required. And we're very happy with the partnership that exists with the governments, as well as the private sector, the NGOs, and also, of course, our donor partners who have really stepped forward to invest in this specific area of early childhood development. And this could be a leading that can set the stage for scale up along the way for not just in the 5 states, but across India.
I'm here today in Hyderabad, and we are just 10 days away or so from the day when about 20 prime ministers from the richest countries in the world, or the most influential, and another 9 guest prime ministers from 9 guest countries will all gather in Delhi here in India as the conclusion of the G20 summit that will close the India presidency. It's an incredible moment which sees this country at the center of the global agenda after a very large, devastating event like COVID-19. What I want to stress is that when it comes to health, India has been very clear in its proposition. Health is universal, is a right for everyone, and is also something that has no boundaries. It cannot be by flags or by countries, because everyone needs to have access to the same type of preventive or curative care across the globe, especially when we're dealing with big global events. So it is amazingly fascinating for me, just a week or so before then, to see a small event like this, if you will, that puts really children at the center of thinking and bringing many partners around one agenda, that is, how can children grow healthy? That's all about what it is, and each and every child, with no discrimination about their conditions, their geography, or their special needs they may have developed before or birth or in early days of their life. And why is it important? Because if we talk of global health, if we have the 20 most influential countries of the world here, global health is about children. If we think about India, India is the largest cohort of adolescents in the world. We are talking of hundreds of millions of children. So if we talk of promoting an health agenda that is global, we need to think of children. Children need to be at the center of it, with a lens that each and every child needs to develop healthy, happy, and with opportunities to grow. So a small seed that we plant today against a very, very much bigger event, but it's a seed that brings together many voices, the UN, the academia, the media, the private sector, the foundations. We hope that from here we will continue growing this agenda, and that India can continue having a central role also when it comes to early childhood development, building models that can be a lesson for other countries going forward. UNICEF has been part of the G20. We had across all the technical working groups across various sectors a seat at the table and a speaking role. Ultimately, I would say we have one very simple role: promote the issues of children and make sure that children agendas are part of the G20 discussion, of the documents, and of the final deliberation.